Hi, hey, can you hear me properly? Awesome. Hi, I'm Dr. Rocky, and thank you for having time today, and thank you for giving me your precious time, of course. How are you today? Okay. Well, that is great to hear. Well, I must say I'm doing fine too. Thank you very much for asking. A very busy day, taking a lot of surveys, and luckily, you're the last one, so a lot of surveys done, so quite busy, really. Well, alright, well, I'm glad you can hear me properly. I'm not stuttering with the microphone or anything. Well, that's great. Good. Well, like I said, thank you for having time today. Today we're going to do a little survey, health survey. Like yesterday or a few days ago, I had you on the phone as well. And, we're just going to do a little local survey about health. We want to see how the population here feels and how they are really in terms of health. As well, you will get a compensation, as you know, at the end of the survey. This is automatic, and you will receive the reward on your bank account, so don't worry about that. So that will be fine. So today we have a few questions. These are going to be health related, like I said. During this survey, please feel free to ask any questions whatsoever if you have any. If we start, or if even before we start, even now, if you have any questions, let me know, okay? Alright, good. Well, I'm glad you're doing fine. That's, of course, great to hear already. So, before we get to the main questions, I have a few little questions that are just a formality that I have to do. This is regarding your name and so on. So, this is being recorded for the purposes as mentioned in the email and on the phone yesterday. So you're all aware of that. If you could say yes for me, then that's also on. Thank you very much. Alright, then we're gonna start. So, of course, your name, first name and last name, please. Okay. Alright. Your date of birth. Alright. Your home address. What number? Okay. That's not far from the clinic, I believe. And number, yeah, okay. Alright. Thank you. And your email address as confirmation. Yeah. Alright, thank you. Then, lastly of that, your phone number. 5? Oh, okay, sorry. Misheard that. Alright, thank you very much. So, let's get to the main important questions, of course, today. Alright, so there we go. So, the first question I have for you, what is your height? And if if you don't know your height, maybe when it was last measured a few years ago, that's fine as well. Okay. Okay. Your current weight or last known weight? Point? Okay. Very good. That's good. Then regarding the weight, have you ever done a BMI test in the past or recently? You have? And what was it? Okay. And have you done that at the local clinic or somewhere else? The local clinic, alright. Alright. Thank you. Alright, so, with current things going on as the world is right now, from a scale to 1 to 10, how healthy do you consider yourself? Yeah? You feel confident with that number? Great to hear. Alright, so, from a scale to 1 to 10, how happy do you feel? Like, do you feel good in your skin? Like, do you feel good like that? Yeah? Okay, good. So, how often do you get a health checkup? Once a year? Twice a year? Alright. Also at the local clinic? Alright. And who is that? Really? Oh. It's a good colleague, I tell you. Alright. Then, regarding health as well, the main thing we try to find out here is what percentage of the people have a chronic disease. Are you aware of any that you might have or that you have? Okay. Thank you. So, do you have any hereditary conditions or diseases? For example, diabetes, heart diseases, or cancer, anything in that perspective? No, not that you're aware of. Okay. When you think of your family, if it's okay to ask, of course, any passings, have they been related to a certain type of disease or a common cause? No? Alright. Alright. Are you on any medication? And have you used any, or that one particularly in the last 24 hours? If there is any? Okay. Okay, that's fine. Now, this is just a normal question. Don't be afraid to answer yes or no. Do you use any drugs, either soft drugs, hard drugs, anything like that? Okay. Do you smoke any type of cigarettes or any tobacco-related products like a vape, e-smoker, or CBD oil or anything in that perspective? Okay. Oh, that's another doctor. Excuse me one moment. Alright. Sorry, it's quite busy office hours. Alright, we continue. Do you drink any alcohol? Okay, and if you do, what type of and how many times a week? Yeah. Okay. Alright, thank you very much. So, do you exercise, and what do you do? Okay, and how long per week? For like 30 minutes, 2.5 hours? Okay. Okay, that's good. Would you say you see yourself as a person who is really fit, has a great stamina, is strong, well built, or how would you consider yourself? How do you see yourself? Just as an average person? Yeah, like that. Alright. Alright, well that's great. In terms of sleep, how's that going? Pretty okay? That's good. And how many hours would you say you sleep on average? So let's say you sleep now at 10. What time will you wake up? How many hours? Okay, so that would be around 8 to 9 hours per day. Or does it variate in the weekend? That's fine. Okay. Would you say you have any troubles falling asleep, or? Okay, great. So, regarding your health, in the last 6 months, a year, have you had any sicknesses or any illness that was really big, like that had an impact on your life, that you had to go to the doctors for, and even had further treatment like medication or anything like that? Just a cold. Alright. Okay, so no flu or anything like that? No. Okay. Is there any case of a surgery in the last year? No. Is there any case of surgery in the last couple of years? Like, let's say go 5 years back? Okay. Now, we're getting to the last few questions, and I know this is a topic that for some people can be very sensitive, which I understand. If you're okay with that, of course. How are you feeling mentally? This is a big subject these days, because these days it's more normal to say it like that, to say it, because, sometimes there's a taboo on saying, I feel this, I feel a bit down or something like that. So how are you feeling mentally? From a scale to 1 to 10, and please give an explanation why and how you feel. Okay. Please elaborate. Sure. Don't worry, there's no right or wrong. Just feel free. Okay. Well, thank you enormously for, of course, answering that question. I know it can be a tough question for some and an easy one for others. So thank you so much for that. Now, of course, in the last few days, you might have received a little paper from the local clinic offering these, help really with this subject, mental subject. Well, and this is the last question. Would you consider any of the given help by the local clinic, or would you be interested to, go to one of the appointments just to see how it is, as is the first one is free, of course. So, alright. Alright. Well, okay. Thank you very much. Those were all the questions that I have and had today for you regarding the survey. Thank you so much for your cooperation today, and we're gonna give you the results within a week in terms of the national, of course, the local results regarding health. Once again, thank you so much for participating, and thank you. Have a nice day, and like I said, your reward will be given to you on your bank account in the coming week. Thank you so much. Have a great day. Take care and be safe, and I hope to see you in good health, maybe in the clinic. Alright, bye bye. I'll hang up. Alright, bye bye.